Welcome to 101 Addiction Counseling Terms Part 1. This 4-part video series can be used for exam prep, continuing education, or just building your confidence in learning about addiction treatment. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. In this video, I'll break down important terms using plain language and clear, real-world examples. Watch this video as many times as you need as a helpful study resource as you learn about addiction. Let's get started. Before we jump in, let's take a quick look at what you'll learn by the end of this video. You'll learn 101 essential terms, 25 terms in Part 1 that often show up on the addiction counselor exam. I'll break down each term in plain language so you're not just memorizing, you're actually understanding. You'll also get a real-world example for every term, which helps you connect the concept to what you might see in the real world or in a case study question. This video is designed to build your confidence, whether you're taking a multiple choice exam or preparing for clinical work. Let's get started. Term 1, motivational interviewing. This is a counseling style that helps clients find their own reasons to make a change rather than pushing them or doing it for someone else. Example. Instead of saying, you need to quit, a counselor might ask, what would be different in your life if you stop using? It's all about collaboration, not confrontation. Term 2 is stages of change. This model shows us the steps people go through when trying to change a behavior, like quitting drugs or alcohol. The main stages are pre-contemplation, contemplation, preparation, action, and maintenance. For example, if someone is just thinking about quitting but not ready yet, they're in contemplation stage. Term 3 is CBT, which stands for Cognitive Behavioral Therapy. This therapy helps clients recognize how their thoughts affect their emotions and behaviors. For example, if a client thinks, I'm a failure, that thought might lead to using. CBT helps break that cycle. Term 4 is harm reduction. This approach doesn't require total abstinence. It focuses on reducing the negative effects of substance use. For example, the needle exchange programs. They help prevent the spread of HIV and hepatitis, even if the client isn't ready to stop using yet. Term 5 is relapse. This means returning to substance use after a period of not using. For example, someone who's been sober for 6 months might start drinking again after a stressful breakup. Relapse is part of the process for many people. It doesn't mean failure. Term 6 is co-occurring disorders. This happens when someone has both a mental health disorder and a substance use disorder at the same time. For example, a client who's dealing with depression and also smokes marijuana daily is considered to have co-occurring disorders. This is super important because both issues need to be treated, not just one. Term 7 is screening. This is a quick check to see if someone might need further help with substance use. For example, a counselor might use a short form like the CAGE or audit to see if a client has signs of alcohol misuse. Screening helps figure out who needs a full assessment next. Term 8 is assessment. This goes deeper than screening. It's a full picture of the client's substance use, health history, and specifically their mental health history. Let's say a client starts services. The counselor would ask about how often they use, their support system, and their past treatment. All of that goes into the assessment to help guide treatment planning. Term 9 is treatment plan. Think of this like a roadmap for recovery. It outlines the client's goals, the services they'll receive, and how progress will be measured. For example, one goal might be attend 8 weekly relapse prevention sessions. Every session should connect back to the treatment plan. That's called the golden thread. Term 10 is triggers. A trigger is anything that makes someone want to use again. It could be a person, place, thing, or feeling, even a smell. For example, a client might say they feel like using every time they argue with their partner. Knowing triggers helps us build solid relapse prevention plans. Term 11 is craving. This is a strong urge or desire to use a substance. It's both physical and mental and can feel overpowering for some clients. For example, a client might say, just smelling alcohol at a party made me crave it like crazy. Recognizing cravings is key to helping clients manage them in real time. 12 is withdrawal. Withdrawal happens when someone stops using a substance and their body reacts. Symptoms can be physical, like shaking, sweating, or emotional, like anxiety. For example, someone detoxing from opiates might say, "I feel like I have the flu and I can't sleep." It's important to monitor this carefully, especially in early recovery. Term 13 is tolerance. That means needing more of a substance to feel the same effect. It's one of the signs of substance use disorder. For example, a client might say, "One pill used to get me high, now I need 3. When tolerance increases, so does risk. Term 14 is abstinence. This means not using any substances at all. It's often a goal in recovery, especially in abstinence-based programs. A client who's been drug-free for 90 days might say, "I'm proud of my time not using and I don't want to go back." But remember, some models like harm reduction may define success differently. Term 15 is denial. This is when a person doesn't recognize or won't admit that their substance use is a problem. For example, a client who's missed work, lost relationships, and still says, "I don't have a problem, I just drink socially," is in denial. It's a defense mechanism and it's common early in treatment. Term 16 is aftercare. Aftercare is the ongoing support that happens after formal treatment ends. It helps clients stay connected to recovery and prevent relapse. For example, a client might finish outpatient counseling but continue attending weekly alumni support groups. Aftercare is often the key to long-term success. Term 17 is confidentiality. This is the ethical and legal rule that client information must be kept private. It builds trust and protects the client. For example, a counselor can't share treatment info with the probation officer or a family member without signed consent. In addiction counseling, confidentiality is covered by HIPAA and sometimes 42 CFR Part 2. Term 18 is group therapy. This is when multiple clients meet together with a counselor to share, process, and learn. Group work builds connection and accountability. For example, a relapse prevention group might meet weekly to discuss coping skills and triggers. Group therapy is powerful because it shows clients they're not alone in recovery. Term 19 is ethics. Ethics are the professional rules that guide how counselors should behave. They protect clients and set clear boundaries. For example, it's unethical for a client to accept a gift from a client or enter a dual relationship. Every exam includes ethics, so know your codes. Term 20 is case management. This means helping clients connect to non-clinical services like housing, job support, or medical care. It's all about reducing barriers to recovery. For example, a counselor might help a client apply for food assistance or schedule a doctor's appointment. Case management is a key part of the whole person care. Term 21 is client-centered approach. This means putting the client's needs, goals, and values first. Instead of telling the client what to do, we explore what's important to them. For example, a counselor might ask, "What do you want to work on in treatment?" rather than jumping into giving them advice. This approach builds trust and empowerment. Term 22 is psychoeducation. It's the process of teaching clients about mental health, addiction, and recovery. Education builds insight and helps clients make better decisions. For example, a counselor might explain how alcohol affects brain chemistry or why cravings happen. It turns confusing concepts into tools clients can use. Term 23 is de-escalation. De-escalation means calming a tense or emotional situation before it gets worse. It's especially important with clients who feel overwhelmed or triggered. For example, a counselor might lower their voice and use grounding techniques when a client gets agitated. This keeps sessions safe and productive. Term 24 is informed consent. This is when a counselor explains the treatment process and the client agrees to participate. It's not just a signature, it's about making sure the client understands their rights. For example, before starting services, the client reviews and signs a form explaining confidentiality and the purpose of treatment. Term 25 is progress note. This is a written summary of what happened in a session. It includes the client's progress, what the counselor did, and how the client responded. For example, a note might say, Client discuss recent cravings. Counselor use CBT techniques to challenge negative thoughts. Notes are how we track change and also how we're able to bill for our services. All right, it's quiz time. This is where you take what you learned and test your memory. I'll say the name of the term, then pause for a few seconds so you can define it out loud. You can write it down or you can just define it in your head. No pressure. It's all about practice, not perfection. Let's get started. Motivational interviewing. Stages of change. CBT. Harm reduction. Relapse. Co-occurring disorder. Screening. Assessment. Treatment plan. Triggers. Craving. Withdrawal. Tolerance. Abstinence. Denial. Aftercare. Confidentiality. Group therapy. Ethics. Case management. Client-centered care. Psychoeducation. De-escalation. Informed consent. Progress note. Here's a few quick learning tips to help you remember these terms. First, try saying each term out loud in your own words. That helps your brain lock it in. Secondly, link the term to a real life situation or example, something you might see with the client. And third, quiz yourself regularly. And don't forget, you can always watch my videos to reinforce what you learned. I made them short, practical, so they can fit into your busy schedule.